a letter from Home State Health, which is one of our Medicaid providers, but they're also evidently going to go out on the marketplace. And they would like us to sign a letter of intent saying that we would like to be a provider for them. So it's basically, we're not signing a contract. I can do it, I just want to show it to you guys. You can look over it, but it's just a letter of intent saying yes, we're interested. So we got that the other day.
So what do they do, or what do they provide?
They are, Home State Health is one of our Medicaid providers, but they also have insurance, regular insurance. So, and since they're talking about the marketplace, I'm assuming they're talking about us becoming providers under their regular insurance as well as their home health, so. The letter of intent just says, yes, we're interested and would like to look more into this, and they'll then send us the contracts and stuff to see if.
We would like to include you in the marketplace network.
Yeah.
I
Meaning
close the
somebody
Home
that's
State Health
provided.
Plan, have a letter of intent, along with the organic program if you'd like to participate.
Yeah, I got out of the car and
This
it
is
just
a warm
blew me
breeze.
across the
Yeah,
street.
okay.
It's a nice warm breeze.
Sorry. It just, the flyer tells you a little bit about Home State Health, which like I said, is one of the new Medicaid providers in the state. New as of, I believe, last year.
It's not costing the city to have that, correct? Okay, that's what you think. For
We
starters.
would get money from them, they wouldn't get money from us. That's the way it's supposed to be.
Just a little bit I
That's-
flashed through
yeah.
here, I mean,
I
it's,
figured that, but.
It's real basic, it's just a letter of intent saying, yeah, we're interested. So they're fishing to see who's interested.
Not that this is a big deal, but I've never heard of that company.
No, it's like I said, it
Probably
just
an
came
upstart.
in.
Yeah.
No, I think it's connected, they're all interconnected, Doc, and I can't tell you.
But I mean, that doesn't mean we shouldn't.
No.
Use it.
just-
I mean, 'cause I had never
We
heard
do
of it.
use it, and we can bill them for our Medicaid
Yeah.
if some of their Medicaid people come in.
But they
We
would,
can earn.
they would provide services to clients in homes, or they would provide services to someone that comes to
No,
them?
they're actually one of the Medicaid providers, so they're one of the Medicaid insurers.
Okay, so that
So-
would be a person that we might bill for
Correct.
services that we
Correct.
provide.
For Medicaid,
Yes,
and this one, if they're out in the marketplace, it would be non-Medicaid.
the marketplace allows consumers to compare and purchase a plan
Yeah.
that best meets their needs and budget. It's like an insurance,
And like I said, these insurance companies, there's a whole bunch of them that are connected.
and I think what they want, this letter of intent is to say that this goes back to us, doing
Billing
credit
private
card billing.
insurance, yeah. And
Billing private insurance, because this is what, they're just saying, we want a letter of intent saying that you will
you'd like to participate with us in this.
be a provider.
So someone can use their insurance cards,
Correct.
Right.
and you'll let them use that insurance at your
Correct,
place.
and then we can bill the insurance for them.
What would they use it for, like shots and stuff?
Immunizations.
Immunizations?
And,
Okay.
I mean, that's probably where we're gonna be at, is immunizations. Technically, if we had a nurse practitioner, we could do other stuff,
Yeah.
but we're gonna be pretty limited to
If
immunizations.
we all want to read that over and make a
We've
decision
checked
later, but it
into,
looks pretty.
like the dietitian some, and that's really hard, even the doctor's offices have hard time to bill for that.
Okay.
The only thing that scares me is anytime you sign a thing, even a letter of intent that says you'll be in network. But you can get out of network too by the same kind of a letter saying,
Yeah.
we are
You
now,
can
we're giving you
usually
30 days
cancel.
notice that we
So
are no
basically you'll
longer
use
in
them
network.
and whatever prices they agree
And that's
to
gonna be
pay.
the same with all of the insurance companies, that's what we're signing on for.
Because you can get out of a network, there's doctors that get in networks and then they go, I don't think much of this network, I'm out.
And I am trying not to be so paranoid about signing contracts. That is part of my problem, is that I have to research them and I have to know exactly what they say. And I have to worry about what we can provide and what we can't provide. Gary came over and we met with the FQHC, and they were kind